We were asked to see a 51-year-old lady who had an 8-year history of severe heart failure. She had received a number of medical interventions, but despite that, her heart continued to worsen. Her cardiologist recommended transplant, but she refused. She came to us for help, and see what happened next. So Camille, tell us about this very unfortunate lady with severe heart failure, and she had failed pretty much most, if not all, of the interventions short of transplant. What was going on with her?
Yeah, so she had been diagnosed with heart failure in 2017. They didn't find any blocked arteries, but since then she'd had a lot of electrical problems. She had a pacemaker, a defibrillator device to synchronize her heart, but she was still having severe heart failure after that. She had surgery on her mitral valve, but still she was out of breath, couldn't walk far. She came to us trying to seek another approach because her other heart failure team wanted her to get a transplant.
I think she was on all the guideline-directed medical therapy that she can tolerate, so she was really maxed out on the allopathic treatment and was still doing very poorly. I don't know if she had swelling in the abdominal area, she had kidney failure. Here's someone who's had severe heart disease to the point that it was affecting other organs. And this is what really worries us, because if you have severe heart failure and you start to have dysfunction or failure of other organs, that's a sign of going into what we call pump failure. It's not able to circulate oxygenated blood and nutrients to the organs to where those organs start to fail. When organs such as the kidney and possibly in her case the liver start to fail, then that puts more stress on the heart. She was someone who was in really dire straits.
When we first saw her, she could barely walk down the hallway before getting out of breath. And she had lots of symptoms of bowel edema with the tightness she'd get in her abdomen and some ankle swelling and gout, because we know diuretics can also cause gout, and she was kind of dependent on that. So we put her on a very strict plant-based nutritional detox, just raw fruits and vegetables. We did some targeted micronutrients like CoQ10, magnesium, curcumin. She also did our ozone therapy as well to try to improve mitochondrial function, improve nitric oxide, and try to make her multi-organ dysfunction improve.
So quite a comprehensive approach. And then she was on milrinone at a fairly high dose. Milrinone is a medication that heart failure patients receive through an intravenous infusion. And this is a medication that we provide heart failure patients essentially when they're at or near their last legs. So this is one of the last-ditch efforts we provide, either prior to providing a mechanical assist device or transplant. They would just be given milrinone just to sort of help them out. With this intervention, what was her initial progression and what were we able to do in terms of her care?
So she actually responded pretty quickly. The first day we had to give her a little IV diuretic. Her exercise abilities improved because that was one way she would assess herself. She could only maybe walk on a treadmill or do an elliptical for less than 1 to 3 minutes. She was able to go to half the diuretics, and we were gradually reducing her milrinone infusion.
Mm-hmm. Yeah, that's important to know, because functional status is an important measure. You may not have all of the blood work and the cardiac studies and the like, and sometimes the cardiac studies may not improve as fast as you think, but the patients start to show what we like to refer to as physiological improvement. So less shortness of breath, more energy, more functional status. So she showed that immediately. We also noticed her kidney function. How did that change over time?
That improved, and we actually increased her fluid intake from when she came here with at least 1.5 to 2 liters of cold pressed juices. I think that helped give her a lot of nutrients as well and hydrate her in a better way intravascularly. And so her kidney function improved by the filtering rate. The bilirubin and a molecule called GGT were coming down, indicating less inflammation in the liver and gallbladder secondary to heart failure.
You know, it's just important because frequently when heart failure patients present to a cardiologist or a medical facility and they're being treated for heart failure, they're given diuretics, which reduces fluid. and oftentimes they're placed on a fluid restriction. We actually take the other approach. We put them on alkalizing, hydrating fluids. And of course, we don't recommend soft drinks or processed drinks. Those are completely eliminated. In this situation, we saw an immediate improvement in her condition with the increased hydration, of course, switching to a 100% plant-based diet that was minimally processed, and the biochemical effects are almost immediate.
Yeah, she made a huge transformation in what we saw clinically and even ultimately with the blood work, like the liver, kidney markers, the BNP were all trending down even as we reduced the milrinone dose by half.
Yeah, it's important to mention improved kidney function because when the heart's not functioning well, it's not circulating blood well, the first organ to be affected is the kidney. So when you start to see kidney function improving, it's, in this case, in my opinion, it's more a sign of cardiac function improving. So these are all signs that we're moving in the right direction. So we're following her very carefully, clinically, biochemically, and adjusting our treatment as we go. So I was really impressed with those findings. So what was the overall outcome to this point? How's she done overall?
I believe she worded it as if she went from like a 2 out of 10 and how her overall feeling of wellness was to an 8 or 9. And that's a huge improvement. And physically and also mentally, she looked a lot better.
This patient has much more hope. I remember seeing her just before she left. She had a big smile on her face. And I think the psychological improvement also adds to this.
I see the progress in my strength, in my health, and I owe that to Dr. Montgomery. God has given them a gift of helping people. We just have to do the work as well.
She's come a very long way after having a severe life-threatening illness for such a very long time. So I hope you got a lot out of that. And of course, as usual, if you have any questions or comments, leave them in the comment section. And until next time, take care. Thanks for watching. If you got value out of this video, please like it, subscribe, and hit the notification button to see our next show.